Hey friends, it's your favorite YouTube therapist, Sarge. It's good to chat with you again. Today we're going to talk about choosing your clinician, either for yourself or for your child, right? And what are some of the factors that you might want to consider when choosing your clinician? Okay, so first thing you should be thinking about when choosing your clinician is, are you typically more comfortable talking with a male or a female? And where does that fall in terms of what you're wanting to work on, right? So this can go either way. If you're more comfortable talking to a male, for example, then maybe you want to schedule with a male therapist. But maybe you've got some extreme issue, like you don't get along with the women in your life, or you don't get along with the men in your life, and you want to work with that. So maybe you intentionally choose that sex, that gender, as a way, because it's a safe place for you to explore that, why you feel the way that you do. There might be some really good historical reasons, such as trauma, or somebody of that gender violated your trust. You know, there's all kinds of different reasons why that might be a factor. So it can really go either way, but it's a thought you should be thinking about before you make that first call. All right, second factor is, of course, going to be age, right? So maybe you feel more comfortable talking to somebody who's closer to your age range. Nothing wrong with that. Again, same, just like with the gender issue, you just want to consider, give some thought to what are you trying to work on with this episode of care, right? So if you are specifically, you've got some anger issues at like Zoomers and millennials, then maybe that's something you could safely work through in your therapy with a younger clinician, right? Somebody who's in their 20s. Or maybe you have some really complex issues around, your dad or your stepdad. And so you're going to be looking for maybe a middle-aged male therapist, right? Just kind of some of the things to be thinking about. But, these things will play out in therapy as long as it is a safe and trusted environment. So you can really get some good benefits from this if you give some good thought to both age and gender before you make that call to schedule your first appointment. Now, the clinic you call or the practice that you call may not always be able to accommodate your requests, but it certainly doesn't hurt to ask. All right, next factor to consider is, do you prefer in-person or telehealth? Now, there's pros and cons to both, right? Like, so telehealth can be obviously very, very convenient, and maybe you live a very active lifestyle. Maybe you live in a rural area where there's not a lot of mental health practices or mental health clinics near you, and so telehealth is going to be the best option in some cases. But maybe you just don't like to talk on the phone or video, and so in person is going to be better. It really varies from person to person. I do a bit of both with my practice, and I really, I like both for depending on the person. But you need to give some thought to what's going to make the most sense for you, and not just convenience, but what's going to get you the most bang for your buck, right? Like, so if you're somebody who typically does better talking to somebody face to face, then you probably want to tell them, I don't really like telehealth. But again, telehealth is a great option. Virtual therapy is a great option for people who need that. I know there's a ton of companies out there like BetterHelp and things like that. We will do a video about that in the future. I think those are great options for people, and especially in an era where we really have a giant shortage of therapists here in the United States. Like, there's not enough therapists for the need, especially for kids clinicians. So if that's what's available to you, then maybe that's something to consider. If it turns out that you're going to be on a waiting list to be seen face to face, and that waiting list is going to be 6 months, but you need help now, or your kid needs help now, then I would take what you can get, with the idea of, if it's not a good match, I could maybe continue to try to get on this wait list to be seen face to face with this clinician that I do want to get in with. All right, next one is modalities, right? So if you're not very experienced with therapy, and you've not had any classes with psychology, you might not know this, but there's many different types of approaches that a therapist can take based on different theories and different modalities. Their training is different. My training that I went to school with is obviously very different than the millennials and the Zoomers that are coming out of school now. And there's pros and cons to that, right? Like, they're learning techniques and theories and new approaches that didn't even exist when I went to school, right? So there's some huge advantage to that. And you have to weigh that against, other factors, such as the ones we talked about before, and as well of, like, how important is it to you to have a therapist who's very, very experienced, or is it not at all? I wouldn't go so far as to say that more experienced means that the person's a better therapist. It's just too complicated to make it that simple. And again, as I said before, the younger people who are coming out of school now, and they're not always younger people, sometimes people change their career later on in life too, so I shouldn't have said it that way, but people coming out of school now are getting exposure to new modalities that I have to go and take separate training for. And I do my best to keep up on that, but there is constantly new theories, new research, new modalities that are coming out. And it is really hard to get in all those trainings in, right? So and some of them are very expensive. So there's some new modalities that are in use right now that I'm not trained in. And there's probably some modalities that I use that people don't use as much right now, right? So it's just something to think about, and that may require more videos in the future to explain the differences from that. But let's just take trauma, for example. So if you are going to therapy because you've had some kind of traumatic event or some previous like childhood traumatic event that you now want to work on and try to get resolution to that, then one of the questions I would be asking when you call is, what trauma modalities does this therapist use, right? Maybe they use EMDR, maybe they use prolonged exposure, maybe they use trauma-informed CBT, maybe they use trauma-focused CBT, maybe they use cognitive processing therapy. Those are all examples of trauma modalities. And there's big differences on them, but there's also some similarities in them. So you can do your own research and make your own decisions based on, what they are. I'm not a particularly big fan of prolonged exposure therapy. I think it's very, very hard on the patient. It takes a lot of emotional strength. Basically what it is you talk about the trauma over and over and over and over and over until it no longer has that emotional impact on you, right? I prefer for my patients, I take a much softer approach to working through their trauma. I like to make sure they've got their coping skills up, and then depending on what their preferences are, I either do a trauma-informed cognitive behavioral therapy or EMDR. And some people love EMDR. I'm a big fan of it, and some people don't. I'm trained in a couple different modalities so that I have those options for my patients. Do your research. There's big differences, and there is a few things that all of these have in common, okay? All right, last factor that I want you to consider when you are thinking about choosing your therapist is reviews. Now, I really want to put a caveat on this, is that yes, once you know who your therapists or the therapist that you're thinking about going to see, what their name is, do a little research. I don't mind. My patients tell me, hey, I researched you before I made the appointment. I appreciate that. I think that's really smart patient care for themselves, that they're making a really good informed decision as to whether or not I'm the right match for them. Keep in mind, though, that with reviews, sometimes those there are times in the field where we cannot. This has not been an issue for me. I'm lucky I have really good reviews, but I know some great clinicians that don't have good reviews, and sometimes it has to do with issues like that person was not getting the medication that they wanted. Okay, so there are certain medications that some doctors and some treatment teams don't like to work with because they're very addictive, or sometimes we do use them, but if there's an addiction issue, we can, right? And sometimes people get really fired up about that. They'll get really mad that they couldn't get their Ambien or their benzodiazepines or their, whatever, Adderall, right? Stimulants, right? So those are the three usually would be like Ambien, benzodiazepines, which is like your anti-anxiety medicines like Xanax, Valium, Klonopin, things like that, and Adderall and Concerta, Ritalin, the stimulant type classes, because some people unfortunately get into addiction and abuse issues with that. So some clinics, some practices don't prescribe that, and people get really, really mad when they can't get their medications. And I get that. I really do. I have a lot of empathy for you if you're in that boat. But they'll go online and they'll trash the entire clinic, or they'll trash everybody that's associated with their care, and not explain that the reason that they were not happy was because they couldn't get the very specific medication that they wanted to have, right? It's the best way I can say that. And I've seen this a lot, unfortunately. It's a very common thing. We in the field can't respond to that. We can't defend why the decision was made. We can't defend what happened with this particular complaint because of HIPPA. So we're the only business that can't go on there and give a rebuttal to a bad review. So keep that in mind. Learn how to read the reviews, but read between the lines of the reviews is an even better suggestion, right? Like I said, I'm lucky. I'm pretty fortunate that all the reviews that I've had have been positive, but I know some great clinicians that just got completely bashed because the doctor they work with refused to give one of those medications that I was talking about before, and they were angry and they took it out on everybody. Okay, so I hope that helps you. I really hope that you have good success in finding the person that you need, finding the right match for what you're trying to work on, and person that's the right age range, right gender, and is sensitive to the issues and uses the modalities that you like, right? It's important stuff, and it will have a factor in, your comfort level with your therapist will absolutely have a factor in how successful you are in treatment. If you have any questions, don't forget to drop them down below, and don't forget to check in the description for a little bit more information and links. And I want to say I really appreciate you, everybody in the audience. Thank you so much. Keep taking care of your mental health, because your mental health matters.